All right. I started at Downstate about 2 years ago, and I'm an epileptologist at Kings County in Downstate. Dr. Rosenbaum was generous to give me funds to start a laboratory at Downstate, a computational epilepsy research laboratory. We study epileptogenesis, ictogenesis, and epileptic networks. And to learn about that work, you can look online. We have several recent publications. I was a little confused about this part of the symposium because it said epilepsy and cognitive impairment. So I thought what was intended was a talk about epilepsy and cognitive impairment, not one or the other. So I actually did a study that's completed now on epilepsy and cognitive impairment. It's under review, and I'm going to go over this completed study with you today. So patients with epilepsy often complain about, and are concerned about memory impairment, and neuropsychological testing of epilepsy patients often demonstrate memory impairment. And memory impairment in patients with epilepsy is often attributed to several factors. One is that patients with epilepsy often have lesions that cause their seizures. And these lesions in their own right could cause memory impairment. Also, patients with epilepsy are taking anti-seizure drugs, and anti-seizure drugs, which are supposed to reduce the burden of epilepsy, cause memory impairment. Finally, epilepsy causes synaptic reorganization that can cause memory impairment. And a recent large study by the Enigma group showed that there are very diffuse changes in white matter integrity, even far from the region that seizures start in patients with epilepsy. But there's been research since the 1970s that have shown that epileptiform spikes, which are really pathognomonic for epilepsy, impair memory encoding. And epileptic spikes are used for diagnosing epilepsy. When you see an interictal epileptiform spike during sleep or during wakefulness, it usually means the patient has epilepsy. And epileptiform spikes, they last anywhere between 20, 40 milliseconds to 200 milliseconds or 70 milliseconds. And they're generated by the synchronized firing of excitatory or even inhibitory neurons, or both excitatory and inhibitory neurons together. So in this study, what we did is we had 78 patients at multiple different universities. And these patients had medically refractory epilepsy. They had tried medications and failed the medications. And they were undergoing evaluation for surgery for their epilepsy. And they had implanted depth electrodes in their temporal lobe that was recording from both the lateral temporal neocortex and mesial temporal lobe structures like the hippocampus. And while the patients were in the hospital and waiting to have seizures, a team came into their room and gave them a laptop, and they did a task where on the screen of the laptop they were shown 12 words, and they were told that they needed to remember the words. And they were shown each word for 1.6 seconds, and then there was a 1 second delay between the word. And then after being shown the words, they had a distractor task where they did arithmetic. And then the experimenter came into the room and said, "Tell me which words you remember." And interestingly, there was a primacy effect where the first words they were presented, they remembered, but not the later words. And on average, the number of words the patients remembered was about 4 or 5 out of the 12. So what we're interested in is whether or not an epileptiform spike that occurred spontaneously during the presentation of a given word would impair the recall of that very word. So we weren't introducing any stimulus besides the endogenous activity that the patients were generating. Why were we doing this experiment? Well, this experiment was actually done as part of a larger research effort to determine whether electrical stimulation of certain brain regions could enhance memory. And what we did is we looked at the controls used for that experiment, where there was no brain stimulation taking place, and asking if the patient's endogenous stimulation would affect memory. And we were looking at, in a neuroanatomical sense, whether or not these epileptiform spikes could be used as a probe to understand the circuits involved in memory encoding and recall. So To test this hypothesis, we used a logistic regression model that had mixed effects. So we had random effects in the model that include the patient number, the session number, because we had multiple sessions of testing, the list number, and the actual words that were used in the trial. And then the main effect that we were testing was how many spikes occurred in each region that we would define neuroanatomically during the presentation of a word. And what we found was that there was about a 25% reduction in the probability of encoding a word if a spike occurred in the hippocampus. And this was important because prior studies had shown that epileptiform spikes do disrupt encoding, but no one had shown that epileptiform spikes disrupt encoding when they occur in the hippocampus. And that's very strange because many patients have mesial temporal lobe epilepsy, and we know from patients like HM that the hippocampus should be important in encoding. But what had been known before and what we replicated is that if a spike occurs in the middle temporal gyrus on the left but not the right, and the same goes for the hippocampus, during the presentation of a word, it will disrupt encoding and the patient will have a 50% decrease in the probability of recalling the word. We then did a subfield analysis and we localized all the electrode contacts by doing segmentation of the patient's MRIs, co-registered with the CTs. And we found that this effect within the hippocampus was specific to area CA1 and the dentate gyrus.
Minute and a half.
So quickly, we repeated this experiment, but we looked at epileptiform spikes that occurred before the presentation of the word, 0.75 seconds before the presentation of the word, to test whether the coincidence of the spike with the word presentation was specific. And notably, when spikes occurred before the word presentation, it did not disrupt encoding. So in conclusion, epileptiform spikes in the left hippocampus and the left middle temporal gyrus in humans with epilepsy disrupt verbal episodic memory encoding. And it's an effect that's temporally specific, which suggests that the synchronized firing of excitatory neurons and inhibitory neurons in the hippocampus and middle temporal gyrus disrupts the memory encoding process. So I think this is important because, particularly for infants and young children that have very severe epilepsy syndromes and on neurocognitive testing exhibit, low IQs, it's very likely that, at least part of the burden of what they're experiencing is from, very frequent interictal discharges. And it may be possible to develop anti-seizure drugs that, in addition to reducing the probability of seizures, will also reduce the frequency and severity of the epileptiform discharges. So probably not going to do too much work following up on this study, but I thought this would be a good topic.
Thank you very much, Shennan.